Many of us take breathing without trouble for granted. However, for those who may have respiratory and pulmonary issues, there are specialized healthcare providers who can help. This week, we celebrate respiratory therapists and the impact respiratory care has had on patients, especially throughout the COVID-19 pandemic. And joining us today is Annette McDonald, Regional Manager of Respiratory Therapy at Backus and Windham Hospitals. Hi, how are you? And thank you so much for being with us today.
Hi, thank you so much for having me. I'm very excited to be here and talk about our amazing profession.
It is. It's an amazing profession for sure. Can you explain your role as a respiratory therapist in the healthcare team and what may have inspired you to become a respiratory therapist?
Absolutely. So a respiratory therapist is part of the large interdisciplinary team that helps make patients better. We are the experts and specialists in cardiopulmonary systems of the body. We take care of people's lungs and hearts. We are frontline in the ICU, the ER, and in outpatient areas as well. I became a respiratory therapist after working as a nurse's aide, knowing I wanted to be in the healthcare career field, but wasn't exactly sure what I wanted to do. And I would see these people swoop in and just kind of be the fixers and make things better when people were anxious and couldn't breathe, when they were really sick. And it just inspired me to really find that to be my way to help people.
And of course, the COVID-19 pandemic has brought respiratory health into the spotlight with so many people talking about it. Can you talk a little bit about your role in managing respiratory issues in patients, especially during that pandemic?
The pandemic was absolutely a once-in-a-lifetime, something that you would never believe if someone had told you ahead of time. As respiratory therapists, we are the people who take care of ventilators, your life support machine. So we were front and center at the patient's bedside. We were helping people before they were put on the ventilator, trying to prevent it with different therapies and modalities. And then once they were on the ventilator, we assess patients regularly on the ventilator. We kind of make changes based on our scope of practice and our specialty to help people come off of the ventilator. So it was definitely an interesting time to be in the healthcare, but a very rewarding time.
Absolutely. So what advice or insights can you share regarding the importance of respiratory health and the role of respiratory therapists in maintaining that health?
So the respiratory therapist would tell you most of respiratory issues are preventable, and it's the simple things we can do and also the hard things we can do. So don't smoke, don't vape. If you're an asthmatic or a COPDer, use your controller medications regularly. Know when to reach out to your care team when you start to get sicker. And really just take good care of yourself, and a lot of your respiratory needs, your illnesses won't have any issues. As respiratory therapists, we're here for you when you need us, and we will promise to take good care of you.
I like that. Thank you so much, Annette McDonald from Backus and Windham Hospitals. We appreciate you taking the time to be with us today.
Thank you so much.
And for more information, please visit hartfordhealthcare.org at the full website right there on your screen.